What is the primary goal of the instrument processing cycle? A. Improve turnaround time. B. Ensure instruments are safe for patient use. C. Reduce department workload. D. Extend instrument lifespan. Answer: B. Patient safety is the central objective of all processing steps. Which step must be completed before any sterilization method is effective? A. Packaging. B. Cleaning. C. Storage. D. Labeling. Answer: B. Organic soil interferes with sterilant contact. Why are manufacturer IFUs critical in instrument processing? A. They reduce training time. B. They standardize hospital policy. C. They define validated processing methods. D. They limit equipment use. Answer: C. IFU specify tested and approved procedures. Which condition is essential for effective steam sterilization? A. High pressure alone. B. Presence of dry heat. C. Direct contact between steam and surfaces. D. Extended cooling time. Answer: C. Steam must contact surfaces to transfer heat. What is the purpose of a chemical indicator inside a package? A. Measure sterility. B. Verify exposure to sterilization conditions. C. Record load temperature. D. Track instrument count. Answer: B. Indicators respond to specific sterilization parameters. Which factor most affects sterilization efficacy? A. Load weight. B. Sterilant concentration and exposure. C. Storage duration. D. Case cart design. Answer: B. Correct parameters ensure microbial destruction. Why must lumened instruments be flushed before sterilization? A. Improve drying. B. Remove detergent residue. C. Allow sterilant penetration. D. Reduce corrosion. Answer: C. Internal pathways require open access. Which packaging error most commonly leads to sterilization failure? A. Incorrect labeling. B. Overloading trays. C. Using approved wraps. D. Applying indicators. Answer: B. Dense loads restrict sterilant flow. What does a failed biological indicator indicate? A. Load recall not required. B. Sterilizer malfunction possible. C. Packaging error only. D. Indicator misuse. Answer: B. Surviving spore signal process failure. Why is drying time important after steam sterilization? A. Improve appearance. B. Prevent microbial wicking. C. Reduce cycle time. D. Increase shelf life. Answer: B. Moisture allows contamination through packaging. Which sterilization method is best for heat-sensitive devices? A. Gravity steam. B. Flash sterilization. C. Low-temperature sterilization. D. Dry heat. Answer: C. Lower temperatures protect delicate materials. What information must be included on a sterilization load record? A. Staff attendance. B. Instrument brand. C. Cycle parameters and results. D. Case cart destination. Answer: C. Documentation confirms process compliance. Why should heavy instruments be placed at the bottom of trays? A. Reduce noise. B. Prevent wrap damage. C. Improve aesthetics. D. Increase load capacity. Answer: B. Weight can tear packaging material. Which monitoring tool provides the highest level of sterilization assurance? A. Mechanical monitors. B. Chemical indicators. C. Biological indicators. D. Load labels. Answer: C. Biological testing confirms microbial kill. What is the main risk of improper instrument assembly? A. Increased cleaning time. B. Surgical delays or injury. C. Higher costs. D. Poor storage efficiency. Answer, B. Malfunctioning instruments compromise procedures. Why must instruments cool before handling? A. Improve inventory tracking. B. Prevent condensation. C. Avoid package damage. D. Reduce staff fatigue. Answer, C. Hot packages are fragile. Which practice supports event-related sterility? A. Fixed expiration dates. B. Clean storage conditions. C. Frequent reprocessing. D. Heavy stacking. Answer, B. Sterility depends on handling and environment. What indicates improper sterilizer loading? A. Clear indicators. B. Uniform drying. C. Wet packs. D. Accurate records. Answer, C. Moisture signals airflow obstruction. Why are rigid containers used? A. Reduce processing steps. B. Provide consistent protection. C. Eliminate indicators. D. Shorten cycles. Answer, B. Containers maintain sterility during handling. What action is required after a sterilization failure? A. Ignore and document. B. Release if indicators passed. C. Quarantine and investigate. D. Relabel the load. Answer, C. Potentially non-sterile items must be controlled. What is the primary reason for following load configuration guidelines? A. Faster cycle completion. B. Uniform sterilant exposure. C. Reduced documentation. D. Improved storage. Answer, B. Uniform exposure ensures effective sterilization. Which condition requires immediate load recall? A. Incorrect label placement. B. Failed biological indicator. C. Minor packaging wrinkle. D. Incomplete load record. Answer, B. Spore survival indicates sterilization failure. Why must peel pouches be placed on edge during sterilization? A. Improve labeling visibility. B. Reduce pouch movement. C. Allow air removal and drying. D. Increase load capacity. Answer, C. Proper positioning supports airflow and moisture removal. What is the main purpose of a load control number? A. Staff identification. B. Inventory tracking. C. Sterilization traceability. D. Case scheduling. Answer, C. Traceability links items to a specific cycle. Which item should be removed from service immediately? A. Discolored wrap. B. Cracked instrument. C. Loose indicator tape. D. Faded label. Answer, B. Damaged instruments compromise patient safety. What does a Class 5 chemical indicator verify? A. Single parameter exposure. B. Sterilizer maintenance status. C. Multiple critical parameters. D. Biological kill confirmation. Answer, C. It reacts to combined sterilization conditions. Why are sterilized items quarantined after a BI failure? A. Policy requirement. B. Cooling time. C. Potential non-sterility. D. Documentation delay. Answer, C. Sterility cannot be assured. Which practice best supports sterility maintenance during storage? A. High stacking density. B. Controlled temperature and humidity. C. Open shelving only. D. Frequent handling. Answer, B. Environmental control protects packaging integrity. Why must instrument sets be assembled according to count sheets? A. Improve appearance. B. Reduce inspection time. C. Ensure completeness and function. D. Lower tray weight. Answer, C. Accurate assembly supports surgical performance. What is the purpose of sterilizer mechanical monitors? A. Confirm microbial kill. B. Track physical cycle conditions. C. Replace chemical indicators. D. Validate packaging. Answer, B. They record time, temperature, and pressure. Which action prevents strike-through contamination? A. Double wrapping. B. Rapid cooling. C. Moist storage. D. Tight stacking. Answer, A. Multiple barriers reduce contamination risk. Why must sterilized packages be allowed to cool before storage? A. Improve labeling accuracy. B. Prevent condensation formation. C. Speed distribution. D. Reduce load records. Answer, B. Condensation compromises package integrity. Which factor most influences low-temperature sterilization selection? A. Tray size. B. Device material compatibility. C. Load quantity. D. Storage space. Answer, B. Material limits determine method suitability. What indicates acceptable sterilization cycle completion? A. Signed load record. B. Past mechanical, chemical, and BI results. C. Dry packages only. D. Green indicator tape. Answer, B. All monitoring methods must pass. Why are manufacturer IFUs prioritized over department habits? A. Reduce training needs. B. Standardize all devices. C. Reflect validated processing requirements. D. Simplify audits. Answer, C. They define tested and approved methods. Which action reduces the risk of wet packs? A. Increasing load size. B. Proper load spacing. C. Shorten drying time. D. Higher wrap density. Answer, B. Adequate spacing improves air removal. What is the primary function of rigid sterilization containers? A. Eliminate wrapping. B. Provide consistent protection. C. Reduce cycle time. D. Increase storage capacity. Answer, B. They protect contents throughout handling. Why is documentation retained for sterilization cycles? A. Inventory control. B. Staff evaluation. C. Regulatory compliance and traceability. D. Scheduling efficiency. Answer, C. Records support accountability and audits. Which practice most supports event-related sterility? A. Fixed expiration dating. B. Minimal handling. C. Frequent reprocessing. D. Heavy stacking. Answer, B. Reduced handling lowers contamination risk. What is the immediate response to a torn sterilization wrap? A. Repair and relabel. B. Release for use. C. Reprocess the item. D. Document and store. Answer, C. Packaging integrity is required for sterility.